Our Honoring Hospital and Healthcare Heroes series wraps up today here at the Greenville Convention Center, and what a place it is to end our week. Touring Eastern North Carolina, the mass vaccination site hosted by Vidant Health, and we've got a very special guest. Brian Floyd, the president of Vidant, joins us now. And first of all, thanks for having us.
Thank you for being here, Ken.
This is amazing, and I can't imagine the logistics it takes to get this place up and running.
Well, I couldn't be more proud of the people of Vidant Health and our community and so many who've come together to make this possible. You know, the last year has been an incredible endeavor for the community as well as Vidant Health in making sure we're here for Eastern North Carolina. I'm just so very proud of all that has transpired over the last year.
Let's take you back about 12 months ago when really the coronavirus started changing all of our lives in one way or another. What was the most difficult point of time for Vidant?
Well, early on, we weren't sure what to expect. And so our very first order of business was how do we protect the hospital so it can protect the community when people get sick. Not knowing what those numbers would be, our whole team had to figure out ways to make masks, as we knew there would be national supply chain shortages. We had to innovate technology to make sure we had ventilators, masks, and all the protective gear. And that involved not only us, but our communities, churches, and others coming together to help us be ready. So first protect the hospital, then start to protect the community through education, and then start taking care of these patients, get us to a day where we could test and find the virus, so building testing capabilities, which we have done and been able to do quite well now, and then finally to vaccination to get us out of this. And so it's just been quite an incredible ride for our health system and our team.
Vidant Medical Center is the premier healthcare facility east of Raleigh here in North Carolina, but Vidant Health as a whole pretty much covers the eastern third of the state, a lot of it being rural. How important is it to make sure the folks in the rural communities have access to the care that's so greatly needed?
You know, it has been amazing, and it has reminded us of just how important rural hospitals are in this region. But actually, whether people realize it or not, most patients have been in our community hospitals, not here in Greenville. So when you look at the total number of patients we take care of with COVID-19 and the sickest of them, most have been able to get their care close to home, and usually our community hospitals have more patients than they do in Greenville. So it's been very important, and we've worked as a system of care here in the East to make sure everyone has what they need close to home.
And you're talking about hospitals in Kenansville and Nags Head and Roanoke Rapids all over the East. As we wrap up now, how excited are you, how optimistic are you that we're rounding the corner and hopefully getting back to some normalcy?
Well, we're all optimistic, right? We feel spring coming, but also we do see vaccinations. We see our numbers coming down, all of which is a great thing. I can't not say to the public, though, we're not out of this yet. And we're going into spring and Easter, and people are going to want to travel. So vaccinate, vaccinate. This is the time. We've made it easy, made it possible, and continue to wear those masks so we don't have another surge again, to keep us getting out of this time that we're in.
Brian Floyd, president of Vidant, thank you for the time. Thank you for you and your staff and all you do.
Thank you.